Have you been feeling tired even after getting a full night's sleep? Do your muscles feel weaker than they used to? Have you noticed more joint pain, low energy, poor balance, or even a drop in your mood? If you're over 50, these changes might seem like a normal part of aging. But what if they're not? What if your body has been trying to warn you about one hidden vitamin deficiency that millions of people have, without even realizing it? Today, I'm going to explain one of the most overlooked health problems I see in adults over 50. Many people ignore it for years because the symptoms appear slowly. They blame age, stress, or a busy lifestyle. But once this deficiency becomes severe, it can quietly affect your bones, muscles, immune system, brain, and even your heart. The good news is that in many cases, it can be identified and managed with the help of a healthcare professional. Welcome back. I'm Dr. Ethan Carter, and today we're talking about the one vitamin deficiency that can make you feel years older than you really are. Make sure you stay until the end, because the final warning sign surprises many people, and it could be affecting someone you love. The vitamin we're talking about is vitamin D. It's often called the sunshine vitamin, but its role goes far beyond helping your body use calcium. Vitamin D supports muscle strength, bone health, immune function, and many other systems that help your body work properly. As people get older, they often spend less time outdoors. Their skin becomes less efficient at producing vitamin D from sunlight, and certain medical conditions or medications may make it harder to maintain healthy levels. That combination can increase the risk of low vitamin D. One of the earliest signs many people notice is constant fatigue. This isn't the normal tiredness that disappears after a good night's sleep. Instead, it's a lingering lack of energy that follows you throughout the day. You wake up exhausted, struggle to stay focused, and simple daily tasks feel much harder than they used to. Many people assume they're just getting older, but fatigue can have many possible causes, and low vitamin D is one of them. It's important not to self-diagnose because fatigue can also be linked to sleep problems, thyroid issues, anemia, depression, and other medical conditions. That's why persistent fatigue deserves a conversation with your healthcare provider. Another common sign is muscle weakness. Perhaps climbing stairs feels more difficult, carrying groceries seems heavier, or getting up from a chair takes more effort than before. Healthy muscles rely on many factors, including regular physical activity, adequate nutrition, and overall health. Research has shown that vitamin D plays a role in normal muscle function. When levels are too low, some people may notice reduced strength and stability, especially as they age. This muscle weakness doesn't always happen suddenly. It often develops so gradually that people simply adapt without realizing what's happening. They begin avoiding stairs, walking shorter distances, or asking for help with activities they once handled easily. Because the changes occur slowly, they may never connect them to a possible nutritional deficiency. The next warning sign is bone discomfort or frequent aches. Vitamin D helps your body absorb calcium, which is essential for maintaining healthy bones. If vitamin D levels remain low for a long time, bones may become weaker over time. Some people experience dull aches in their lower back, hips, legs, or ribs. Others notice that even minor bumps seem more painful than they used to be. It's important to remember that bone pain can have many causes, including arthritis, injuries, osteoporosis, or other medical conditions. Persistent or worsening pain should always be evaluated by a qualified healthcare professional instead of being dismissed as just aging. Another surprising symptom is getting sick more often. Your immune system depends on many factors, including good nutrition, sleep, exercise, and overall health. Vitamin D plays a role in supporting normal immune function. Some studies suggest that people with low vitamin D levels may be more likely to experience certain infections, although maintaining healthy vitamin D levels is only one part of staying healthy. It is not a cure or guaranteed protection against illness. Many adults over 50 also notice changes in their mood. They may feel less motivated, less interested in activities they once enjoyed, or simply not feel like themselves. Mood changes are complex and can be influenced by stress, life events, medications, medical conditions, or mental health concerns. Some research has explored a possible connection between vitamin D and mood, But no one should assume that vitamin D alone is the answer. If you're experiencing persistent sadness, anxiety, or depression, it's important to seek professional medical advice. Balance problems are another warning sign that often goes unnoticed. Have you ever felt unsteady while walking or noticed that you're losing confidence in your balance? Falls become much more dangerous after age 50 because they increase the risk of fractures and long recovery periods. Muscle strength, vision, inner ear function, medications, and neurological conditions all affect balance. In some people, low vitamin D may also contribute by affecting muscle performance. This is why maintaining healthy muscles becomes increasingly important with age. Regular physical activity, especially strength and balance exercises recommended by your healthcare provider, can make a meaningful difference in maintaining independence and reducing fall risk. Many people are surprised to learn that certain groups have a higher chance of developing low vitamin D. Adults over 50, people who spend very little time outdoors, those who consistently use strong sun protection, individuals with darker skin tones, and people with certain digestive disorders or kidney disease may all have an increased risk. Some medications can also affect vitamin D levels. However, risk does not mean certainty. The only reliable way to know whether your vitamin D level is low is through appropriate medical evaluation, which may include a blood test if your healthcare provider believes it's necessary. Taking large amounts of vitamin D without medical guidance isn't recommended because excessive vitamin D can also be harmful. So if you've been feeling older than your age, lacking energy, noticing weaker muscles, or struggling with persistent aches, don't ignore those signals. Your body may be asking for attention, not because aging has defeated you, but because there could be an underlying issue worth discussing with your doctor. The one vitamin deficiency that makes you feel old after 50 Part 2, approximate 1,000 words. Now that we've covered the common warning signs, let's talk about something even more important: why this deficiency happens in the first place. Many people assume that eating a balanced diet automatically provides enough vitamin D. Unfortunately, that's not always true. Unlike many other vitamins, vitamin D is naturally found in only a limited number of foods. And as we get older, our bodies become less efficient at producing it from sunlight. That means even people who believe they're living a healthy lifestyle can still develop low vitamin D levels. One of the biggest reasons is simply spending less time outdoors. Modern life keeps many of us inside homes, offices, or cars for most of the day. Even when we do go outside, we may wear clothing that covers most of our skin or use sunscreen to reduce the risk of skin damage. Sun protection remains important because it helps lower the risk of skin cancer. So the goal is not to avoid sunscreen. Instead, the key message is that vitamin D status depends on many factors. And if you're concerned about low levels, it's worth discussing with your healthcare provider rather than making assumptions. Diet also plays an important role. While some foods naturally contain vitamin D, the list is fairly short. Fatty fish such as salmon, sardines, and mackerel are among the richest natural sources. Egg yolks contain small amounts, and some dairy products, plant-based milks, breakfast cereals, and orange juice may be fortified with vitamin D, depending on where you live. Even with these foods, however, some people may still have difficulty maintaining healthy levels, especially if they have medical conditions that affect nutrient absorption. Another factor many people overlook is body weight. Vitamin D is stored in body fat, and research suggests that people living with obesity may have lower circulating vitamin D levels. This doesn't mean everyone with obesity has a deficiency, but it does highlight why personalized medical advice is so important. Every person's health situation is different. Certain medical conditions can also interfere with vitamin D absorption or metabolism. Disorders affecting the stomach or intestines, including some inflammatory bowel diseases or conditions that reduce fat absorption, may increase the risk. Kidney and liver diseases can also affect how vitamin D is processed in the body. In these situations, simply eating more vitamin D-rich foods may not be enough, and professional medical care becomes especially important. Now, let's talk about supplements. Many advertisements make vitamin D sound like a miracle pill that can instantly restore youth and energy. That's simply not true. If testing confirms that your vitamin D level is low, your healthcare provider may recommend a supplement at a dose that's appropriate for your individual needs. But taking very high doses without medical supervision can be dangerous. Too much vitamin D can raise calcium levels in the blood and lead to nausea, vomiting, constipation, confusion, kidney stones, and in severe cases, kidney damage. More is not always better. The safest approach is to avoid guessing. If you've been experiencing symptoms such as ongoing fatigue, muscle weakness, frequent falls, or persistent bone discomfort, speak with your healthcare provider. They can evaluate your overall health, consider other possible causes, and determine whether testing for vitamin D is appropriate. Let's also clear up a common myth. Many people believe that if they feel tired, vitamin D must be the problem. In reality, fatigue has many possible causes: poor sleep, stress, dehydration, anemia, thyroid disorders, heart disease, diabetes, depression, medication side effects, and many other conditions can all contribute to low energy. That's why a complete medical evaluation is much more valuable than self-diagnosis. The good news is that healthy habits support your body in many ways, regardless of your vitamin D level. Regular physical activity helps maintain muscle strength and bone health. Eating a balanced diet rich in protein, fruits, vegetables, healthy fats, and calcium supports overall wellness. Getting enough sleep allows your body to recover, while staying socially active and mentally engaged benefits brain health as you age. It's also important to schedule regular medical checkups. Many health conditions develop silently over time without causing obvious symptoms. Routine screenings can help identify problems early, when they're often easier to manage. Prevention remains one of the most powerful tools in healthy aging. If you're over 50, don't assume that feeling weak, tired, or less active is simply the price of getting older. While aging naturally brings changes, persistent symptoms deserve attention. Sometimes they may be linked to lifestyle factors, sometimes to nutritional deficiencies, and sometimes to completely different medical conditions. The important thing is not to ignore them. Remember, healthy aging isn't about trying to feel 20 again. It's about protecting your strength, independence, mobility, and quality of life for as many years as possible. Small, consistent healthy choices often have a greater long-term impact than quick fixes or miracle products. Before we finish, here's one final message I want every viewer to remember. If you recognize several of the symptoms discussed today, don't panic, but don't ignore them either. Listen to your body. Make an appointment with your healthcare provider, ask questions, and work together to identify the real cause. Accurate diagnosis is the first step toward effective treatment. Thank you for spending your time with me today. I hope this information helps you better understand why vitamin D matters and why paying attention to your health after 50 is so important. If you found this video helpful, please give it a thumbs up and share it with a friend or family member who is over 50. You never know, this information could encourage someone to seek medical advice and improve their health. Don't forget to subscribe to the channel and turn on notifications so you never miss our weekly videos on healthy aging, nutrition, and practical medical advice designed to help you live a stronger, healthier life after 50. Until next time, I'm Dr. Ethan Carter. Stay informed, stay active, and take good care of your health.